Hello juniors, so I welcome you all again in the continued series of upper limb and thorax, and today we are going to cover an easy yet an important topic which you all must have also covered in your pre-med school, and that is arch of aorta. So in today's module we will be covering arch of aorta, its courses, relation and branches. So without wasting further time, let's move ahead. So this is the basic diagram, basic orienting diagram I have given for you. So arch of aorta, starting with its introduction, it is the part of the aorta which connects ascending and descending aorta. So this is the ascending aorta which arises from left ventricle, and this is the descending aorta which supplies blood to the whole body. So arch of aorta connects both the aorta, which are ascending and descending aorta. So lies in the superior mediastinum. So by the way of review, I have given here the diagram of mediastinum. This is our superior and this is our inferior mediastinum. Inferior mediastinum is further divided into anterior, middle and posterior mediastinum. So mainly arch of aorta lies in the superior mediastinum. So done with the introduction, coming to the course of arch of aorta. So this is the diagram. This diagram, once zooming out for you, this diagram which I have taken covers almost 90% of the course and relations of arch of aorta. So I request you to hardly memorize this diagram, as this diagram is very helpful for you for writing course and relations of arch of aorta. So course begins behind the upper border of second sternocondral joint. So what is a sternocondral joint? It is a joint between the sternum and the ribs, and the second joint. So the arch of aorta starts from the second joint of second sternocondral joint. It runs upward, backward and to the left across the side of bifurcation. It runs upward, backward and to the left. You won't be able to appreciate the left direction of arch of aorta, which I'll shortly make you in further diagram. Across the side of bifurcation of trachea, this is our trachea, and here it got bifurcated. Then it passes down behind the left bronchus and on the left side of the body. So this is our left bronchus, clearing away my ink for you. This is our left bronchus. It passes down behind the left bronchus. This is the left bronchus. It passes down behind the left bronchus and on the left side of the body of fourth thoracic vertebra. This is our fourth thoracic vertebra. So arch of aorta is furthermore lateral to the body of fourth thoracic vertebra. It thus arches over the root of left lung. So left bronchus is also a part of root of left lung. If you haven't watched my video on root of lung, go and check out that video. That video will help you to easily understand this topic. Nextly, it ends at the lower body of fourth thoracic vertebra by becoming continuous with the descending aorta. This is the fourth thoracic vertebra. It ends at the lower body. This is the lower body of fourth thoracic vertebra and get continuous with the descending aorta. This is our descending aorta. Clearing away my ink for you. So done with the course of arch of aorta. Lastly, I have thus the beginning at the end of arch of aorta are at the same level, although it begins anteriorly and ends posteriorly. What he is saying is arch of aorta begins and ends simultaneously at the same level. So this is our anterior, this is our posterior. So arch of aorta begins at this level and ends again at T4 level, which are the same level of starting and ending, but arch of aorta starts anteriorly and ends posteriorly. So in this diagram you will be able to appreciate the left deviation of arch of aorta. Arch of aorta initially was right here in the middle, but then it got deviated to the left. Covering the relations of arch of aorta, this is the transverse section diagram of arch of aorta at the level of fourth thoracic vertebra. This is the fourth thoracic vertebra. This diagram is taken from BDC. So we have taken the transverse section at fourth thoracic vertebra as this section will help us to fully view the arch of aorta and its relations. So we are viewing this relation. So my point of view of viewing this arch of aorta is from downside, that is, if a patient is lying supine, we are standing at its feet and we are viewing the arch of aorta and its transverse section at fourth thoracic vertebra. Anterior, right side, posterior and left side. Covering relations one by one. Anterior and to the left. We are not classically, we covers the relation as anterior, posterior, right, left, superior, inferior or like that. But in case of arch of aorta, since the structure is in curve or in arch, we are covering its anterior and its left relation simultaneously, and likewise we will be covering its posterior and right relation simultaneously. Covering the anterior and relation to the left include left lung and pleura, phrenic nerve, vagus nerve. So this is our left lung and its pleura. This is our phrenic nerve. This is the vagus nerve. Left relations also include left cardiac nerves, and anteriorly I have thymus. So left cardiac nerve and thymus. So once if you keep this image in mind, you will easily able to note down the relations of any anatomical structure. So posteriorly and to the right I have esophagus, trachea, and to the left I have left recurrent laryngeal nerve. In the posterior and in the right I have thoracic duct, and this is our right vagus nerve. Trachea, esophagus, left recurrent laryngeal nerve, thoracic duct, and lastly I have vertebral column. Coming to the superior relations just tells us the anatomy of arch of aorta, which are brachiocephalic trunk. All these three arteries which arises from arch of aorta comprises the superior relations of arch of aorta: left subclavian artery and left common carotid artery. All three arteries are crossed close to their origin by left brachiocephalic vein. This is the brachiocephalic vein. I am not emphasizing on the relations of this structure as you already have covered in your pre-med school. And lastly, covering the inferior, which is bifurcation of pulmonary trunk, left bronchus and ligamentum arteriosum with superficial cardiac plexus on it. To view the relations, inferior relations, we have to come back to this diagram once again. As I have told you, this diagram covers the 90% course and relations of this arch of aorta. So I would recommend you to hardly memorize this diagram. So what are the inferior relations of arch of aorta? This is bifurcation of trachea, which is beneath the arch of aorta. This is the left bronchus, and thirdly the author says ligamentum arteriosum. So what is ligamentum arteriosum? Ligamentum arteriosum is a fibrous remnant. Ligamentum arteriosum is a fibrous remnant of ductus arteriosus. What is ductus arteriosus? It is the connection between the pulmonary artery and to the aorta. What happened? Connection between the pulmonary artery and to the aorta, which is patent in early life, but it spontaneously get closed, and that connection becomes the ligamentum arteriosum. So that ligamentum arteriosum is beneath the arch of aorta. And lastly, the cardiac plexus. What is cardiac plexus? Showing you here for your orientation. This is our arch of aorta. Here I have ligamentum arteriosum beneath it, and this is our cardiac plexus. It is a nerve plexus which is also beneath the arch of aorta. So done with the superior and inferior relations as well, covering the branches. Branches are nothing but all these three structures which also form the superior relations, which are left subclavian artery, brachiocephalic artery, which is divided into right common carotid and right subclavian artery, and left common carotid artery. That concludes our video on arch of aorta. If you find this video helpful, do share it with your friends. Thank you.